Hi everybody, this is Dr. Eliana Aaron, Director of EMA Care. I hope everyone is doing well. Today we're going to talk about a few subjects. The first one is I want to review the maps of Jerusalem and Beit Shemesh, and as far as understanding what they mean. We don't have a lot of new cases anymore, but what we do know is that most of the new cases remain in these, quote, hotspots. And the government has successfully reduced these hotspots to very limited neighborhoods within cities. And even though there are still hotspots, the actual amount, if you look at the graphs that I've created showing the different statistics as far as changes over the last few days, it keeps changing. So when we look at that, we can see patterns. And then we can also see that the programs that we have for shutting down these communities has actually worked to help people. So I'm just going to quickly share my screen to explain what we did. Here we go. And these are different cities. And what you can see here is in most cities, we had some kind of a peak. The peak sometimes was this bright red, which is over 50%. That means that over the course of the previous approximately week, there was a 50% increase in cases. So that's obviously a crazy number. And then, like in Jerusalem, you can see that we went down pretty quickly, and now we're in a much safer place. We're still reproducing this virus. It's still growing, but at a much slower rate than it was a couple weeks ago. So those are good things to track as far as are these closures that have happened in these neighborhoods in Jerusalem. Is that something that's working? And the answer from these graphs is yes, it is working. What we also see in some areas that as we had more openings happening, there have been slight upticks, specifically in areas that have not been shut down and that maybe have not been badly hit. So relatively speaking, even though Tel Aviv has high numbers relative to their population, they have pretty low numbers. But what we can see here in Tel Aviv is the white represents that there was no growth at all, is that we had a slight uptick, and we have to track that. Same thing in Netanya. We had the same thing in Modi'in, in Bat Yam, in Migdal HaEmek, and what we've seen in Netanya, Rishon LeZion, and in Ashkelon. So what we've seen is that it seemed like we had no cases, and then now we have some cases. So we have to see if people are jumping a little too quickly to leave their houses and potentially exposing themselves. So that's one of the things I wanted to just discuss with you. Now, as far as the maps that we saw last time, I sent to you the maps that were released today showing the hot spots in Jerusalem. So I'm just going to bring that up. Sorry. Here's my screen share coming right up. Here we go. So basically what we have here is a map of different Jerusalem neighborhoods, and the darker color represents the number of the most intensity as far as the disease density for that population. So you can actually see, this is a really good visual. You can actually see that it's a hot spot. Now, if you ever see this on your body, you have a 3rd-degree burn. So this area over here, and you can see where some of these areas are warm, but not hot, let's say, but potentially problematic. This area here corresponds to this area over here. This area over here represents several different neighborhoods. I'm just going to stop my screen share real quick and go through some of those neighborhoods. So some of those neighborhoods are Ramat Shlomo, the Belzer neighborhood, Montelsdorf, Givat Kamuna, Ezrat Torah, Machanayim, Bucharim, Mea She'arim, Geula. So a lot of the ultra-Orthodox neighborhoods are very much still having an issue with the coronavirus in their community. But you could see also from this that most parts of Jerusalem are pretty quiet. Another area of concern is Har Nof, which had been shut down, and it may get shut down again because it's starting to heat up again, so to speak. Now in Beit Shemesh, I showed you already the map of Beit Shemesh, and in Beit Shemesh what we have is we have two neighborhoods that look problematic. It looks like Ramat Beit Shemesh Bet again, and the Neve Sapir or Nachala Umenucha, sorry, I can't pronounce it, but those areas are also flaring up again. So Beit Shemesh did not get completely out of the closure that it was in, and it looks like there's a good reason for that. Ramat Beit Shemesh Bet is still very problematic, so I assume they will have to continue their closure. Although their numbers overall came down, they're still not where they need to be in a safe place. So that's kind of important. Now I'm going to get to the questions and answers. For those continuing strict social distancing, what would have to happen to stop this social distancing? Are we waiting for a vaccine, or would you do it before? Well, waiting for a vaccine is basically locking yourself up for potentially 2 years. I mean, we're hoping it'll be sooner. So that's not realistic. I think that going back to the way things were pre-COVID is not necessarily going to happen anytime soon. And even after we have a vaccine, I think people are going to be looking at some of these situations that we normally put ourselves in terms of, is this a smart thing to be doing? You know, when you're in a very crowded place and you're exposed to a lot of people, it's a great place to get the flu. It's a great place to get COVID, obviously, but it's not particularly hygienic. And I think people are starting to realize that we need to not be touching everybody and be thinking about what comes into our house and what we're touching and what we're exposed to. And I think that's going to really make a big difference in terms of how we think in the future. However, what are we looking for right now? What we're looking for right now is potentially, number one, some seasonal changes. So as the season changes, we're hoping that this will really be tamped down quite a lot. What we're looking for also is what are the results of all of this change that has happened in the last 2 weeks, right? So in the last 2 weeks, in Israel at least, we opened up quite a lot of things. We did not wait in between the different sectors opening up. There's a lot of economic pressure. I'm not minimizing that. But part of the problem is that we also don't know what the consequences are. And it's really a very big concern because we're doing step A, step B, step C. We don't even know if step A was okay. And it's not prudent. And we may end up having some rebound effects of that. We won't know yet. Some of those figures and colors that I showed you coming out of those cities that have been doing well may be the beginning of something bigger. I hope it's not, but that may be the first sign. So I'm not necessarily waiting for a vaccine. I think there are going to be periods of time when social distancing is going to be much more stringent, and there are going to be times when it could loosen up a little bit. I think it's important to be very prudent and careful and to use your head and not just say, oh, but it's allowed now, so let's do it. I think that's really important. I also think there needs to be better screening. We're going to talk about that probably, I'm estimating either after Shabbat or on Sunday. We're going to talk about that because there's a lot of thought about how we're screening people when they go to work, how we're screening people when they go shopping. And it may not be accurate, and we may be not capturing a good part of the people that are actually ill, and that's dangerous. So I think that there's a few things missing. I think it's still early. As summer happens and people want to get out more, go to the beach, go to the pool, and otherwise socialize, have barbecues, you know, get together with people. I think that you know, we still have another month or so before we need to make some of those determinations, but I also think that waiting for a vaccine to leave your house is probably not good. I think people, when they stay home long enough, they become a little agoraphobic and they become afraid to leave their house. They feel like danger is out there and I'm safe in here. And I've seen this happen in the last few weeks with people who were in their homes who are high risk or elderly, and it's not healthy. So it is important to get fresh air, to get out, to walk, to do certain things. I think is important to do, because we don't want to end up, no matter when things normalize, we don't want to end up being emotionally or physically challenged and struggling to leave your house because of fear. So let's keep that in mind. What accounts for the low death rates in Israel compared to other countries? And then they specifically are asking that there seem to be more healthy middle-aged people succumbing to the disease in areas like New York. These are really good questions. You know, there's been a controversy about testing versus social distancing. And we do know that towards the beginning of this virus, people were talking about testing and testing and testing and testing and more testing and more testing. And people were looking at social distancing and which countries are being strict and which countries are not being strict and how quickly are they moving. Those are all really good questions. And I think that this disease is going to be studied for many, many decades to come in terms of what happened here. We're collecting a lot of information. You know, and everything that we're saying right now is guessing. I mean, we don't really know. Israel has the highest of the countries that I'm evaluating. I'm talking about developed countries that have populations, that have a nice number of cases, that are developed and not lying about their cases. Israel has the highest rate of testing. That's great. A certain percentage of the testing, as I wrote today in the group, is retesting, but most of it is new testing. But Israel is not casting a wider net, and in recent days, there's been some reports that our numbers of testing have actually started coming down because Israel has not changed the criteria. So right now, Israel is only testing people who have direct contact with people who have a confirmed case of coronavirus, and they have to have symptoms, and those symptoms are still narrowed down to fever, cough, dry cough, and respiratory distress or frequent breathing. Those are the symptoms that qualify you for a test officially. They're more flexible with healthcare workers, but it's a problem because they may not be capturing everybody. And certainly we know a lot of people have it and have no symptoms, and they may not qualify for testing at all. So even though Israel's doing great with testing, you know, less than 5% of people being tested test positive. So that basically means that we don't know what else is out there, and we're not, even though we are able to test 20,000 tests a day almost, what ends up happening is we're testing about 12 or 9 because people don't qualify for the test. So instead of saying, okay, let's start testing people who have some of the other symptoms, the CDC added other symptoms in. They're not doing that. And I don't know why, if the testing is available and we've already paid for the testing, why they wouldn't do that to try to capture more of the people who might be sick and are not being captured till they're quite sick. I don't have an answer. I'm not a politician, but that is one of the issues. And this is an issue every country is facing. There have to be criteria. You can't just say, hey, I have money, I will pay for a test. It doesn't work that way. So that's one of the criteria. Another one was social distancing. So one of the things that Israel did very early, and they did this, you know, before Israel even had a single case here, Israel closed the borders to the high-risk countries. At the time, the high-risk countries were China, specifically Wuhan, but I believe the borders were closed to China. The borders were closed to Singapore. We're going to talk about Singapore probably also in, if I can today, but probably it's going to be after Shabbat. And we're going to talk, and then we closed the borders to Japan at some point, and Hong Kong, and then of course to Italy. In Italy, we closed the border. It was till January. We closed the border. Israel did not get a single case until towards the end of February. So Israel was able to do that. Israel has very few borders, so it's easy to close. A lot of countries have open borders. European countries have completely porous borders with, you know, if you're in the European Union, it's a free-for-all. So very hard to do that. I think that helped to mitigate a lot of the issues that other countries had. A lot of other countries spiked very early and then struggled and are still struggling to get those numbers down. So that's one of the things that we did right. I also think that having a healthcare system in Israel where every citizen has access to healthcare keeps people in relatively better shape because they have access to healthcare and they access that healthcare. It's part of the culture here. We're very proud of the healthcare system. And Israel is, again, a relatively healthy country. When you look at countries in terms of obesity, in terms of heart disease, there's a lot of preventative care here. We have all the same problems other countries do, and we have other problems we have worse than other countries. But the issues that affect coronavirus are issues that have to do with underlying health conditions. And a lot of people can be overweight, let's say. And in America, for example, 60% of people are overweight, at least overweight, if not obese, but 60%. So that's very high. And even if that's the only risk factor, that's a very significant risk factor for COVID because it causes issues with breathing. So that's why people snore. Think about the heavy person who's snoring at night. They're snoring because their respiratory tract is being weighed down by extra fat. So these are guesses. What I could tell you is that testing alone is not the solution because there are countries that have tested at pretty good rates and have many more cases than Israel relative to the population. And there are countries who did social distancing really well and they have kept their numbers down. So I think social distancing is more important than testing, honestly, because it prevents you from getting the disease. Testing just captures more people who are sick, but preventing the disease is about social distancing on a policy level and how well you can implement it. It's very hard for me to see people on Facebook like, I'm in quarantine because my son has coronavirus, but I'm going for a jog. And I saw that in New York. What they call quarantine is not what we call quarantine. Quarantine in Israel is you register with the government, you sign an agreement, you agree to the conditions of quarantine, and you will get fined if you don't keep quarantine. And there's a lot more tracking. So there's a lot of controversy about that. Freedom of movement, freedom of speech, whatever you want to call it. If the government is tracking you to keep track of your health, there's going to be controversy. And I don't think that most places in America really want to start doing that because if we think there's a lot of protest now, it's just going to get worse. On the other hand, people went into quarantine and had no idea what they were supposed to do. There was no guidance. I remember at the beginning, people in America were contacting me in Israel and saying, what are we supposed to do? We're supposed to be in quarantine. No one told us. And that's a problem because you can't really keep quarantine unless you have instructions. So there were a few issues here. I do think that social distancing and having good regulations is extremely important in keeping the numbers down. So I hope everyone stays well, stays healthy. I would stay home unless you really need to. And I'm going to come back on the weekend to talk about the some of the new screening things that are being suggested, as well as what happened in Asia, Singapore, South Korea, Japan, very low death rates. They're doing fabulously, or are they? And we're going to talk about that. Take care. Bye.